COVID-19 pandemic is disrupting immunization activities in a lot of ways. For countries affected by both COVID-19 outbreaks, weighing the benefits of conducting safe and effective vaccination campaigns against the risk of increasing transmission may be a little bit challenging. Oman is all set, led by the Ministry of Health. And to talk about this, it's an honor to welcome is the Director of Nursing Services at the Dahira Governorate, Ahmed bin Saeed Al-Saidi. Sir, welcome to the program.
Hello, Frank, and thank you for having me today. COVID, as known for everyone, is a worldwide problem. Its devastating impact is huge. It impacted actually almost all aspects of our lives. Besides the precautions, such as wearing masks, hand hygiene, and social distancing, vaccinations showed high effectiveness in fighting the pandemic.
All right.
In the Sultanate, Ministry of Health set a plan actually to vaccinate as much as possible of all people in the country. Previous campaigns included groups such as people above 60 years old, also chronically ill individuals,
yes,
healthcare workers, 12th grade students and their teachers, and employees in different governmental and private sectors. Now the plan actually is to expand the vaccination to include individuals in different age groups.
Looks like that we got good news in the horizon with another round of mass vaccinations soon to take off. Can you give us an overview of the program there in your wilayat?
Yes, actually the good news is that the vaccine has showed effectiveness, and the Ministry of Health plan actually is to include a new target group, those who are 45 years old, to receive the first dose of the vaccine, and also to continue with the previous age groups that has been announced before.
Specifically, who will be in the new target groups aside from the 45?
Actually, we'll continue with those who are over 60 and the other age groups, but the campaign that will be launched soon is to target 45 years old and above. Yes, so the new campaign actually that will take off is including this age group. That will start 21st of June.
The situation there in the other wilayas, aside from Dahira, of course.
Actually, the campaign will start the same day in all wilayats. Not only in Al-Bahira. It has 21st actually is the date that is set for everybody to launch the program, the vaccination program, and the same scenario actually applies to all wilayats in the country.
How about Muscat? It's going to be on the 21st too, right?
Exactly.
Okay.
Everywhere.
The vaccines arrived recently. Do you have any plan to control this?
Well, actually, when we receive the vaccine, it is received centrally, and it is stored in the central vaccination store actually in Muscat. The vaccine then gets transported to different governorates on a weekly basis. From the governorates, actually, the vaccine are then dispensed to different health institutions and also to different vaccine centers as needed. The process is controlled actually very strictly to ensure proper storage and handling.
What kind of vaccine are they going to give to the public?
Actually, we have both Pfizer and AstraZeneca. So they are available actually, and they will be dispensed accordingly. Like whatever is available will be used actually to vaccinate the public. So far,
the situation there in your area, how many people have been vaccinated already?
The total number of the people who got vaccinated from all the groups that I have mentioned to you earlier is around 16,000 actually in Al-Bahira, something around this number, and we are actually hoping to vaccinate even more. And the number is actually those who got vaccinated with the first dose.
For the second dose, they already had the vaccines recently?
For the second dose, actually, yes. There are vaccines which are available. We started giving people appointments to actually come and receive their second dose.
What's the procedure here in your area? Been prepared by the...
Yes, actually, and this is almost similar in all the governorates. The coming round of vaccination is expected to be involve mass number of individuals. For that, actually, there will be designated places equipped with all necessary requirements for the vaccination. The work has already started to get the places ready for the launch of the campaign, which I already mentioned, which is on 21st of June, 2021. And for example, actually in Al-Bahira Governorate, we selected number of halls that can accommodate large number of individuals. And for the preparation, we work collaboratively with other public and private sectors. And also we have volunteers who will be helping in the organization and control of the crowd. We have a system also in place of how the person who's supposed to get vaccinated, of how they will move through the whole, starting from the reception until they receive their vaccination. And also we require actually that all vaccinated individuals is to stay at least for 15 minutes after the vaccination. Other logistics include providing adequate vaccine supplies to meet the required quantity.
You're going to be expecting a lot of people are going to be going there, right?
We expect actually a lot of people, and because of this, we have made an appointment system where we can manage actually the number that we receive on a daily basis. And the A group actually might be expanded in the future. So we even have put in our thoughts actually of how to accommodate even larger number of people.
Any challenges that you foresee aside from this in the process?
In fact, in the preparation of the campaign, several discussion meetings were held with all stakeholders to prepare for any expected challenges. For example, we expect, as we mentioned, actually the crowd is to be huge, especially in the first few days of the campaign. Hence, an appointment system, actually, we, as I mentioned to you, is prepared to control the rush and also maintain all necessary precautions.
Yes.
But no other major challenges actually are expected to occur. However, teams are prepared to handle any issues during the campaign.
Especially, the public where they can reach the venue there. The authorities are really there to control.
For example, one of the collaboration is with Royal Oman Police.
Okay.
Who will be there actually to maintain the crowd and to ensure the safety of everybody who is getting to get vaccinated. We have also volunteers, as I mentioned to you, who will be guiding people, who will be helping people to get oriented to the place and also to maintain the flow.
Furthermore, any plans aggressively implemented measures that will eventually lower, if not totally get rid of this COVID cases in the Sultanate?
Actually, we hope to get rid of all the cases if we can. But for now, actually, the plan is to expand the vaccination and to continue vaccinating as much people as we can, and to include other age groups as well. People are encouraged to continue using necessary precautions, such as wearing masks, social distancing, and all things that everybody knows by now, to prevent the spread of the infection. Vaccination centers, where we expect huge number of people, it is very important actually to implement the precautions. And also, people even in their social life, in their workplaces, and everywhere are encouraged, use all the precautions.
The measures.
The measures actually, which will help for sure to reduce the transmission of the disease.
Any message, any advice to the public before we go to make sure that people are in order to go to the centers?
Yes, my big actually advice and big message to the people is to use precautions. Wear masks, ensure social distancing, wash your hands, and ensure that you be safe all the time.
Thank you very much, sir, for giving us some important information about this vaccination campaign that's going to be on the 21st. It starts on the 21st down in Dahira and all other wilayats in the Sultanate. Thank you very much for this opportunity.
Thank you very much, Mr. Frank.
The Director of Vaccination Affairs at the Dahira Governorate, Ahmed Saeed Al-Saidi. I'm Frank. Thanks for listening.